provide for my patients. They are also the ones that we look to now in our collaborative practice at OSF. The social workers or the case manager nurses are the ones that know what's going on in the community and can help us get those resources that are going to be supportive to the patients, but are not necessarily something that is covered by their insurance or provided by a skilled individual. So the community care program offers these type of non-skilled services and that you can access in the community. In-home services where they can get personal care, meal preparation, transportation, laundry services, all those things that help them be able to stay in their own home but have the support for the things that they just can't do on their own anymore. Adult daycare services. This is like daycare for geriatric people. It really provides them an opportunity to go out and interact with people. They're for patients who have families at work and they really need somebody to help take care of them during the daytime. This is a great opportunity for them to go ahead and have a resource that they have people to help them with their medication. They can go ahead and provide their meals, and they give them some socialization. So it's one of those things you can look at for those people that have difficulty transitioning from the acute care setting to the home setting because their family members are just not there 24 hours a day. Emergency home response are just those little buttons that can summon help for those people when they're on their own. And then companions, because a lot of these older patients will want some type of interaction. They just want somebody they can talk to and they can have some socialization with to make their day. Now, for some people, these resources won't be enough and they'll have to employ somebody. So there are a number of different resources in this community, again, where you can pay a certain amount of money, depending on your income level and your affordability, and hire somebody to come in and provide some of these non-skilled services for people. And again, help them maintain their living in their own homes and with their family members who might not be available throughout the day. Other sources would be the parish nurse. They do screenings. They can sometimes provide different resources in the home. Peace meals, Meals on Wheels will provide nutrition for those people at home when the family members may not be available or somebody can't come in and prepare their meals for them. And again, another great opportunity for socialization. My wife used to do Meals on Wheels, and she would take our son before he went to school with her. And some of these patients on her route would look forward just to them coming to visit because they wanted that interaction, not so much that they really enjoyed the Meals on Wheels, because sometimes they weren't very good. Transportation is another big issue that you will see some of these people trying to live in the community, but they cannot drive anymore, and their family members may not always be readily available. So these are, again, resources that your social workers can help you access for these people and get them to their doctor's visits, or get them to dialysis, or get them to the grocery store, things that they might want to do. Again, trying to find ways that it makes it easier for you to feel comfortable with your members or your patients leaving the hospital and going to somewhere other than the nursing home. So what if they do need some skilled services? What if they need some services, a therapist, or they have a wound vac and they need the nurse to come in and check the wound vac? It doesn't have to be done every day. So it's an intermittent skilled level of care. So that can be done in the alternate living facility. They can come into their apartment